Good morning, Palm Springs, and thanks for joining me for this edition of DAP Live. Grab a cup of coffee and join the conversation as we talk with Bruce Richman, a man who started a movement called UequalsU. UequalsU stands for Undetectable Equals Untransmittable, and it's changing the way that we think about HIV status. It's removing stigma for those living with HIV, and it's reducing anxiety for those going to get an HIV test. What this means is it makes it a lot more likely that those who need to know their status know it and get connected to the care and life-saving medication they need to live a long and healthy life. We have a very special guest this morning. We're joined by Bruce Richman, who was the founder of Prevention Access Campaign and really the brainchild of UequalsU. Undetectable means untransmittable, which is a campaign that's gone global and for so many people living with HIV has really changed the way they look at themselves and changed the way they're able to connect with the people they love. Good morning, Bruce.
Good morning. Thanks for having me, Stephen.
So this campaign, I don't know if you know this, but at DAP, one of our community health professionals actually created masks with UequalsU that he's been getting out into the community. So it's kind of, even during the COVID pandemic, taken on sort of new meaning. You've got a lot of people all across Palm Springs wearing your message right across their face.
Well, I would say it's our message. It's not my message. It's everyone's now. I was really excited. I think I'm getting one of those masks. I think my colleague Murray is sending me one. They're very cool.
Awesome.
Great to see those.
So tell me a little bit about how this got started. I know for you it was a very personal experience that brought the science behind this to the forefront. But you've talked about it being sort of your calling.
Yeah, absolutely. I mean, I learned that because I had an undetectable viral load, I couldn't transmit HIV through sex back in 2012. And that was 9 years after my diagnosis. And it changed everything for me because I never thought that I could have sex or conceive children or just even be intimate with someone without that fear of passing on HIV. And it just rocked my world. But then I found out that so many people weren't being told about it, and they were being told that they were infectious, and they weren't infectious. And it was happening on a massive scale. So that's kind of how this all started happening. I started talking to other people who also knew UequalsU is true, and I found some people that were wonderful people in the field that were in leadership positions that would join with me, and then we. In summer of 2016, we created a consensus statement with scientists to confirm that UequalsU was true. And then we took that statement and went out and got influential people and organizations like Desert AIDS Project to sign on and to join us in endorsing that when you're undetectable and you're on treatment, you cannot transmit HIV through sex. UequalsU.
And it's really changed for so many people living with and not living with HIV. It's changed so much about how we look at this. Particularly, talk to me a little bit about how it's changed just the notion of anxiety around getting tested and then living with HIV.
Well, we're seeing people using the UequalsU message in their outreach, their HIV testing outreach, because it reduces that anxiety associated with testing. So if someone feels that HIV isn't as a death sentence, isn't going to turn them into someone that is a vector of disease, isn't toxic, all these old ways of thinking about HIV, then people are more likely to get tested if you reduce that stigma. And then in terms of the daily lives of people with HIV, it's changing so much. I mean, when you look at there are folks who live with HIV that are still suffering from extreme forms of stigma in their communities. And for them to even, kind of go into a clinic or to bring HIV medication home and have it in the cupboard instead of hiding it in the car, to going out to take their medicine in the car. There's so much that so many ways that stigma interferes with the quality of life for people living with HIV. And again, this is reducing that fear of people living with HIV. And it means that we're not at risk. In fact, we're safer than someone who is HIV negative and just had a test, a few months ago. And, that person still could have contracted HIV in the meantime. We know that we are undetectable, we take our medications, and we can't transmit HIV. It just changes so much about our lives, about the field. People are getting married, that people are having babies. They pointed to their children, told me, this is because of UequalsU, or shows me their wedding rings. There are people who have UequalsU tattooed on their bodies. We've seen people from Australia, from the UK, from the US with, UequalsU all over. It's really, it gives us a new freedom to love, to be intimate, to have sex without any fear and without any shame.
Yeah. And I don't know if we talk about that enough, about how stigma can prevent us from getting the test we need, right? Because living with HIV, if you have access to medication, you can live a very, very long life, a very full life. But if you don't know that you have HIV and you don't have access to the medication, there can be all kinds of complications. I remember early on when I was going for my first HIV test, I think I was more scared of how I would tell someone that I cared about if I was positive than I was actually worried about living with the virus. And I think that's still true for a lot of folks who haven't got this message that UequalsU. It is life-changing. Tell me a little bit about the importance of that in terms of ending the epidemic, right? Because if we don't know our status, and if we don't have access to the medication we need, we're not going to end the HIV epidemic. Why is stigma still so prevalent?
Well, those are two big questions. Why is stigma still so prevalent, and UequalsU role in ending the epidemic? I think this was really interesting to me. Is I didn't understand that UequalsU had a role in playing in ending the epidemic in terms of preventing new transmissions. And I always really focused on improving the lives of people with HIV and ending the stigma that we have faced for so long. But in terms of ending the epidemic, UequalsU is essential. As Dr. Fauci says, UequalsU is the foundation of being able to end the epidemic, because the more people who are on treatment and undetectable, the fewer new transmissions that there'll be. So in the United States, when you think of, half of the people living with HIV are not on treatment and not in care, and they're not getting the treatment and care, the services they need to stay healthy, they're also not getting those services that they need to stay untransmittable. So, if we really want to end the epidemic and save lives, we're going to make sure that we invest in the well-being of people living with HIV so they can stay healthy and prevent new transmissions. So it's really, I like that you asked that, because we need, in advocacy, we need to link investing in the well-being of people living with HIV to ending the epidemic. Because when you invest in the well-being with people with HIV, you prevent new transmissions. And that's a big deal. In terms of stigma, why is stigma still around? I think stigma is complicated because it's intertwined with all kinds. HIV stigma is intertwined with all kinds of stigma and sex negativity. There's the homophobia, transphobia, stigma against people who inject drugs and sex workers, and then the just deep-seated negativity and against all kinds of STIs. So, and HIV stigma is particularly embedded in this country because of the last 35 years of fear-based messages, and what we've remembered since the early days of the 80s. And I think it's also something that is really hard to unlearn. It's really hard to relearn those decades of fear of HIV and people living with HIV. So it'll take a long time. That's why we have to keep saying U equals U. The people living with HIV, we can't pass it on. If you make sure that all of us have the treatment and the care that we need to stay healthy, we're not going to pass on HIV. There's no fear. You can have sex, babies, love, no risk.
Yeah. Did you think when you started this, maybe you hoped, but did you think it would become a global movement? It's really become a global human rights movement today. Did you think that would happen at the scale that it's happening? I mean, it's really what, 5 short years ago that you started this.
We launched it 4 years ago.
4 years
Yeah,
ago.
I mean, we started building it around 5, but we launched in summer of 2016. I was just speaking to someone about this today. No, I didn't think it was going to be like this. And I've always been really behind the scenes as well with my work in the past. So I just knew this had to be done. We had targets. We had the CDC. We had UNAIDS, World Health Organization, public health associations, and research associations. And so we were very focused in terms of who we needed to move forward in our advocacy. And we had numbers I think at the end of the first year, we're going to have 75 in the US, and we had already had 200 at that point. But this just goes to show the power and the passion and the brilliance of people living with HIV around the world who are standing up to, change the narrative about their bodies and to, reclaim our lives from public health systems that are deeply inherently flawed, racist and paternalist, and all those sort of isms that have prevented this information from getting to us, this life-changing information. So it's almost 1,000 organizations in 101 countries now. It's
Wow.
It's phenomenal, and so many different languages. It works in so many different languages too.
So I read somewhere that you ascribe to sort of the Buddhist philosophy of be happy and help others be happy.
Yeah.
I love
did your
that.
research on me. Where did you find that?
I love that. Tell me about how that informed. I mean, what you've done is you've created this this movement. You've created social impact. You've created social change. And I think for a lot of people that might be watching this and wondering how they could start in some small way to be part of the solution, if not in this movement, in another movement. Tell me a little bit about how that sort of informed you, because I think it's so powerful that this movement really, to me, when I look at this movement, it's sort of it's like holding a sign that claims the intrinsic value of human beings, of all human beings, and that's so powerful.
Yeah, I think that's the importance of this is that I was driven by the fact that this wasn't fair, that this information was just getting to me. This is like life-changing, incredibly important information. And it was getting to folks like myself, like we're white and privileged and well-connected. And everybody needed to have this information. And I felt like it was bringing the possibility of love and intimacy and hope and sex to people. And so I kind of was just driven by that this made me happy. I want to help other people be happy, especially people who are already marginalized by healthcare systems that are not responsive to their needs or designed to eliminate them. And so it was really driven by that. It's like, and I couldn't understand why some people in the field wouldn't share it. When I was just like, it's so basic. When you go to a restaurant and you like the restaurant, you tell somebody, or you see a good movie, you want to share it, right? Why were you enjoying UequalsU for the last 5 years with your partner, but you didn't tell your own staff? Those sort of things. I would say, I don't understand. And then you go back to, so when you're starting a movement, you have to be, especially something that's going so against the status quo, that's so challenging, radically challenging and not just the status quo in the medical establishment, but within the community itself. There are all these norms and structures, power structures and alliances. You just have to be driven by truth. You just have to keep going. Don't just find your allies, understand that you're gonna, you just have to keep keep focusing on like principles, like be happy and let other people be happy, and that the truth will set you free. And a lot of us kept going back to our values, and we can't give up, even though it seems like sometimes we're not going to win.
Yeah. So you mentioned allies, and I love that notion. We're in a moment in time where we're all, I think, considering what does that mean to be an ally to so many marginalized communities, and we're looking for the language, right? I think we're all looking for the language. We don't want to use the wrong language, but I think when I think about this movement, and what I've read, language is really important to you. It's very important to be specific and clear about what U=U means, right? That we don't waver on being in a gray area. We're very clear, right? Talk to me about that specific language as an ally of someone who wants to share this information and use the right language. What is that language?
Yeah, that's important. So, it's important to be really clear when you talk about U=U, because if you talk about risk, because we're talking about the risk between one human being and another human being in the most intimate moments of our lives. And that language can either bring us so much joy and hope and freedom that we never thought would be possible, or it could destroy us. So when you say things like can't transmit, that's great. No risk, we could even say zero risk now. Top scientists are saying zero risk. The CDC is encouraging people to be flexible. CDC has said you can say U=U, but if you say things like almost no risk or virtually no risk, or extremely low risk or things like that, opens up a little window of risk.
Right.
And that's still a risk. And any window of risk puts our lives at risk, for all kinds of harm, internal or external harm. So it's really important to be clear in that description. And then also not just in the language, but how you say it. So there are people, you might have heard this, that'll say, well, I believe in U=U, but use a condom just in case.
Mm-hmm.
Well, and so that but is the big eraser. I believe in U=U, and you might want to consider condoms for other STIs as well, and unintended pregnancy. But if you're undetectable, that will prevent the transmission of HIV through sex. So these buts don't, and then this other one that's sort of like, I believe in U=U, but you're only as good as your last viral load test. So as if in between tests that the viral load is just going to shoot up if you're adherent to your medication. It doesn't do that. It doesn't shoot up to infectious levels. If you're taking your medication and you stay and you get your labs done, and you should have no problem. There are blips occasionally, but blips are not anything of consequence. Just take your medication, get your labs done, and stay connected to care. So there's ways that people can say it, and there's another one. The catch-all is, I believe U=U, but you never know, And if the truth is, no, we do know. It's okay. We know U=U. So thanks for asking about that, because that is it. We have a whole workshop on how to communicate U=U and helping people to practice communicating it, because it's still uncomfortable for a lot of people to talk about it in sexual health.
We're gonna put the your website is terrific. It's got a lot of information. It's got social shares that allies can use. It's got tips about the language that we should all be educating ourselves about. And so we'll make sure that we share that and make it easy to access for anybody who wants to join this movement. But and by the way, I love the fact that this is science-based. This is fact over fear, right? Because I think we're all right now living with so much fear and uncertainty in this world, that anything where we can focus on fact and science and certainty is very affirming. So that's incredible. You've been a disruptor. Obviously, this is what you do. You create movements, and you use social to create movements. And the movement's now sort of getting to a space where it's already reached a global audience. But tell me where you see the future of this going. What's the next big disruption? Who are tomorrow's thought leaders that you're hoping come on board to continue carrying this forward?
In terms of U=U, what's the next frontier?
Yeah.
The next frontier is using U=U in advocacy for increasing access and removing barriers to treatment and care. So I'll explain it. What the way around the world, our argument used to be that we need access to treatment, or whether it's supportive services like housing or employment or food security or mental health count. We need increased access to treatment and care for the well-being of people living with HIV. That was our argument, and that should be enough. That should be enough.
Yeah.
But now we have this other really, really important argument, and we're working very hard to get it across to advocates, actually, especially in the US, where we have such dismal access to treatment, or so many barriers to treatment, I would say. We're going to get across that now we can say we need access to treatment, and removing these barriers, not just for the well-being of people living with HIV, which should be enough, but also to prevent new transmissions.
Mm-hmm.
Okay, so that's called the public health argument. So if we can use UequalsU as that public health argument, we'll move forward so much faster in getting people the care that they need to stay alive, to thrive, and to stop new transmissions. Because UequalsU it has to be a revolution that includes everyone. And using it as that public health argument in advocacy is going to be essential to make sure that everyone gets to a place where they have the option to benefit from UequalsU. And we're working, and that's something we've been working on with other countries, advocates in other countries, and also in the United States especially. Is everybody has to be able to have the option to benefit from UequalsU. It has to be a revolution that includes all of us living with HIV.
I love it. Okay, well, we can be part of that revolution. Of course, go to this website that's right below this interview, learn more about this campaign and how you can become part of it. And together, we can make sure everyone has the access they need to testing, treatment, and care. Because the thing that I love most about this is it's breaking down isolation. It is connecting us to community, and it is making sure that no one is sitting at home feeling stigma or shame or fear unnecessarily, because UequalsU, and we're all part of that goal of getting connected. Thank you so much for taking the time to talk with us this morning.
Thank you, Stephen. Thanks for having me. I appreciate it. Thanks for your support.
Well, that's it for this edition of DAP Live. Thanks for joining us and spending a little bit of time over a cup of coffee having this conversation. If you have ideas about guests that we should feature in the future, add them to the comments section below. We'll make sure that we keep the conversation going in a direction that inspires you and gives you the information you need to stay in action.